So my name is Julie. I am a dolphin trainer over at SeaWorld San Antonio. I had hurt my back 7-8 years ago. I was carrying an ice chest, probably around 100 pounds. At the time, was holding it around my chest area. I started to walk down a hill. I had a small little slip. In order to catch myself, I leaned back with that heavy chest still in my arms, and I felt my back get very uncomfortable. But I had never had a back injury before. I half expected it to be a little uncomfortable afterwards. But it just continued to be uncomfortable and never felt like it was getting better. It felt like it was slowly getting worse, or it would just kind of become stagnant. I went to the doctor. They did an x-ray. They told me that I had a herniated disc. Never had one before. I don't believe anyone in my family ever had one, so I was just like, all right, whatever, I'm gonna let it go. It'll heal itself. This was also during COVID, so a lot of places shut down, with hospitals, of course, getting such an influx of people with COVID. I had moved back home but continued working with animals because we were still essential workers. We still needed to work to care for them. So I started working with horses after going back to Jersey, and I just felt like it was not getting better. I would have these times where I would forget all about it, but then I would have a flare-up, and those flare-ups would make it impossible to sleep, walk, move, to comfortably go to the bathroom, to really live a normal life for somebody who was at the time only 24. But I still was stubborn, and I let it go, and I would just, it would have a flare-up and it would calm down again. And then when it would calm down, it would be convincing myself, okay, it's fine. When I came to Texas to chase this dream of becoming this trainer, I had another flare-up, but this time it felt different in the sense that it felt like it got worse. Not only was it just congregated in that L4, L5 area, it was starting to go into the right side of the glute, and then I started to feel pain down my leg, which had never felt that. I came here, and Dr. Huffman talked to me about, the disc is now pushing up against this sciatic nerve, which is why I'm having this pain down the leg, in the foot. And then he had recommended, he gave me many options. He gave me the option of surgery. He gave me the option of just doing physical therapy and seeing if it got better. And then he also mentioned decompression therapy, because my big thing was I didn't want to do surgery. I didn't want a Band-Aid. I wanted to fix it. So his big recommendation was the decompression. He told me what it was, how it was to help stretch the spine, to help the disc slowly but safely slip back into place. So I was like, all right, let's do it, because I want this, I don't want this to impede my life. I'm not even 30 yet. So, thinking about kids, thinking about the future, progressing in my field, I didn't want to push it off anymore, because I already learned my lesson that by pushing it off, I just made everything worse. I was on crutches, I couldn't stand up straight, I couldn't walk, I couldn't sit for very long, all because of this injury to my disc, all because of this burning down my leg. So we started the 4 days a week for 2 weeks, and it went to 3 days a week, and it took time, but I'm at a point now where I don't feel any pain, really. If I feel any discomfort, I know how to handle it with the stretching or the physical therapy that I was shown while here doing the decompression, and I've been able to go back to a normal life. I'm able to go to the gym 5 days a week. I'm able to go to work and not have to worry about it. I am not afraid of what my future is going to look like because of this injury, because this decompression has helped so much, on top of doing my homework by going home and doing the physical therapy and doing everything that I had to do on my end, because, it was gonna be a team effort amongst the decompression, the team, and myself. And I'm just really grateful that I don't have to worry about being uncomfortable or in pain anymore. And then the first 4 days of doing the decompression, you don't go from 0 to 100. They have to slowly increase the weight that they are stretching your back out. So, because if it goes too fast, too quick, it's gonna hurt again, or it's gonna make it worse. So the first week was pretty tough. The second week, once we finally got to the point where I could reach my personal max, taking in, my weight time or divided by 2, once I reached that, it felt better. But you definitely, once you hit that, you feel your spine being pulled. It doesn't hurt. I mean, it's a weird feeling. It's a little uncomfortable, but you can feel it. And I remember the first time when I got to the point where I could reach the max weight that they can pull me at, I had the pain shooting down my leg into my foot. It was burning. And when I got that first good pull and that disc came off, I could feel that burning sensation almost completely go away. And that was the first 2 weeks. On the third week, when I was coming back for the 3 times a day for a week, same thing. I was still on crutches at the time. I was still having discomfort, but every time I would lay down and do that next pull, I could feel the disc coming off of that nerve, and it would feel really good at the time. By that 3rd, 4th week, right within that time frame, I started to get off those crutches. Around that 4 or 5 week, I said to Dr. Huffman, I was like, hey, I feel like it's been going really, really well. I'm off crutches, but then for a week, I was like, I feel like I'm off again. Like, I'm back on the crutches. I feel like I've regressed a little bit. And he said, don't worry. We're gonna change the angle that we're pulling it. And that small change in that angle to give a better pull, we went right back into progressing and keep going. And it's the same thing. It's just, you feel your spine being pulled, but it's weird, not painful. And even now, that's what I feel. It doesn't hurt. If it's the harness itself, you feel like you're being held together well and tightly and secure, but you can feel at the same time that things are happening, and that's very encouraging. At least for me it was. And I was able to sleep. It was able when I was starting to walk for a longer period of time without it hurting. It was being able to sit down without it really starting to hurt. Once I was kind of within the range of I'm more uncomfortable than in pain, that's when I went to Dr. Huffman and I was like, this is what I'm feeling. It's still uncomfortable, but I also wanted to continue to do my part. So I'm like, the decompression is doing good, the physical therapy is going well. I'm like, but I know that these muscles and everything, they started to atrophy, and I know that because of in use. Am I in a good spot to start working out, and like, what parameters should I stay in? Because I want to be able to continue this progress. So once I told him my symptoms, that he would offer suggestions as far as stretching, or at least, don't lift anything over 20 pounds. So I would give myself 18 or 15. So I would still stay just under what I was given and then build from there. So I would say 5-6 weeks after the initial start of the decompression is when I started to go back to the gym and start moving around a little bit. And then also at work, getting a little bit more comfortable to be lifting something, because I was doing okay at the gym, and luckily everybody at work was very kind about it too. I started treatment, I would say beginning of September 24, like 10 months-ish. So under a year, I would say I'm about 95% back to everything that I was able to do prior, and I definitely foresee it. Like I was saying, if you're gonna do something that's gonna fix the problem, it might take a little longer, but it's fixed, and then it's done. It's no more Band-Aids. It's no more, I'm okay for 3 months, and then I have to come back and do it again. Like, this is it. Like, you put the time in now so you have more time later. So even after just 10 months, and this time flew by, it feels like a long memory of when I wasn't even able to stand up to now. So for me, I go to the gym 5 days a week. I do more weight training. So I do 2 days of upper body, 2 days of lower body, and then a day of cardio in between, whether that's, an hour on the treadmill, walking on an incline, or swimming, or a light jog for the most part. And then I do, an upper body, lower body, cardio, upper body, lower body. So a nice spread out weight training throughout the day. And it varies from, it's a legs day, like squats, glute exercises, calf exercises, push and pull, same thing with arms, shoulders, back. I enjoy fitness, so I enjoy trying to push myself to that next limit. And then, but it's also really helped me to have a better mind to body connection, So if I start, even if I have the tiniest little discomfort in the area of my lower back, I simply stop, reevaluate, and then change the exercise. Rather than feeling like, oh, I can't go to the gym anymore. Oh, I can't do this anymore. It's like, no, you can still do all of those things, just make a small tweak. So it's making small changes to an exercise or the way I move that I can still have the life I want while continuing to heal. So for me, that's been my plan. That's been how I've attacked this. I was just doing not any lifting really. I was doing night work, so I was driving, but I was still moving. So I would say if I had to give it a brackets amount of time, I would say 0 to 2 was tough, but it was because we had to start. It has to start somewhere. 3 to 5 was when it was like, all right, I'm starting to really notice these changes. I'm really noticing that these things are starting to not be as painful anymore. From 6 to now, it's been normal life stuff, small tweaks here and there to make sure I'm not re-aggravating the problem. So I would say that's kind of been my personal progression in the healing. No pain at all.